Many seniors are unaware that their actions before a blood test could be distorting the results, leading to misdiagnoses and unnecessary treatments. Recent studies reveal that nearly half of all blood panels in people over 60 show false elevations or deficiencies caused by simple, everyday behaviors in the hours before the test. These false readings can prompt doctors to prescribe medications they don't need or miss early signs of serious health issues. The problem is widespread. Seniors often believe that fasting or avoiding certain foods is enough, but they overlook other critical factors. For example, not drinking water, exercising, or taking supplements can all interfere with lab results. The consequences of these mistakes are profound, from false diagnoses of kidney disease to misinterpreted cholesterol levels or heart health. This video will reveal the 10 most common mistakes seniors make before blood tests, ranked from least to most dangerous. Knowing these can dramatically improve your health outcomes and ensure your doctor gets an accurate picture of your health. The most common mistake, dehydration, and its impact number 10 on our list, is not drinking enough water before a blood test. Hydration status is crucial because dehydration thickens the blood, making it more concentrated. This condition, called hemoconcentration, can falsely elevate values like hemoglobin, white blood cells, and electrolytes. Many seniors forget or avoid drinking water, fearing it might interfere with fasting. But the truth is, dehydration skews results and can suggest conditions like anemia, inflammation, or even kidney issues that aren't actually present. Research from the American Journal of Clinical Nutrition shows that drinking 2 cups of water an hour before testing can reduce false high readings. For seniors, supplements. The hidden Number 9 is taking supplements on the day of your blood test. Many seniors believe that their vitamins or herbal remedies are harmless, but they can actually interfere with key markers. For instance, vitamin C taken shortly before testing can artificially lower creatinine levels, which are essential for assessing kidney health. Iron supplements can falsely elevate serum iron levels, masking anemia or suggesting overload. Similarly, B12, fish oil, or herbal products like ginseng and turmeric can alter hormone panels, liver enzymes, or cholesterol results. If you're scheduled for blood work, it's vital to skip these supplements at least 24 hours beforehand unless your doctor advises otherwise. Always inform the lab or your healthcare provider about every supplement, including over-the-counter remedies and herbal teas. This simple step can prevent false alarms that lead to unnecessary tests or medications. The coffee and tea trap. Fasting misconceptions number 8 is drinking coffee or tea during fasting. Many seniors mistakenly believe that black coffee or unsweetened tea are permitted because they contain no calories. However, caffeine and certain compounds in tea can influence blood sugar, stress hormones, and platelet function. Drinking these beverages can temporarily raise glucose levels and interfere with lipid and hormone panels, leading to false results. Even decaffeinated tea can contain bioactive compounds that affect test outcomes. For accurate results, only plain water should be consumed during fasting, usually 11 to 12 hours before the test. If you're unsure whether your routine might interfere, ask your doctor or lab technician. Remember, fasting isn't starving, it's about allowing your body to return to baseline so the lab results reflect your true health status. Medication management, to take or not to take. Number 7 involves the common mistake of skipping medications before a blood test. Many seniors worry that their pills might interfere with results, but skipping them can cause more harm than good. Certain medications like blood pressure pills, diabetes meds, or thyroid treatments are meant to be taken consistently. Suddenly, stopping them can lead to inaccurate readings like high glucose or blood pressure that are not reflective of your usual health. For example, skipping metformin might temporarily raise blood sugar levels, falsely indicating poor control. Conversely, stopping blood pressure meds can cause dangerously high readings, prompting unnecessary medication adjustments. Always consult your doctor before stopping or altering your meds before testing. The best approach is to bring a list of all medications and inform the healthcare staff this way. They can interpret your results accurately. Exercise. The hidden distorted number 6 is exercising before your blood test. Many seniors start their day with light stretching or even moderate activity, thinking it's healthy. However, exercise causes temporary hormonal shifts, releasing cortisol and adrenaline, which can elevate blood sugar and inflammation markers. These spikes can mimic prediabetes or inflammation, leading to misdiagnosis. A study in 2019 showed that just 30 minutes of walking before fasting blood tests increased glucose and C-reactive protein levels significantly. Exercise also causes dehydration, which can falsely elevate kidney function markers. To get accurate results, avoid any activity that raises your heart rate or causes sweating for at least 12 hours before your test. Resting quietly in a hydrated state provides the most accurate reflection of your baseline health. Fasting duration. Don't overdo it. Number 5. Is fasting too long? Many seniors believe that longer fasting makes results more accurate, but overdoing it can backfire. Fasting beyond 12 hours can cause the body to release extra glucose from the liver, falsely elevating blood sugar levels. It can also lower HDL cholesterol and raise LDL, skewing lipid profiles. Research shows that fasting over 13 hours increases fasting glucose by 22% and LDL cholesterol by up to 15%. Additionally, prolonged fasting can make seniors feel dizzy or weak during the blood draw, increasing fall risk. The recommended fasting window is 8 to 12 hours. Anything longer isn't just unnecessary, it's potentially harmful. Stick to the guidelines. If your appointment is at 8 a.m., stop eating by 8 p.m. the night before. Recent illness and blood tests. The hidden warning sign number 4 is failing to disclose recent illness or infection. Many seniors believe that once symptoms disappear, they're clear to go for blood tests. But recent illnesses like colds, flu, or urinary infections can leave lingering effects, elevated white blood cells, inflammation markers, and liver enzymes that can be misinterpreted as new problems. A 2019 study noted that seniors recovering from minor infections had white blood cell counts 30% higher even weeks after symptoms resolved. If the doctor isn't aware, this can lead to unnecessary referrals, antibiotics, or further testing. Always inform your healthcare provider about recent illnesses, medications, or over-the-counter drugs, especially antibiotics or anti-inflammatory drugs. The timing of your test matters, and revealing recent health issues ensures accurate results. Timing is everything. The best time of day for blood tests. Number 3 is scheduling blood tests at the wrong time of day. Hormone levels like cortisol and testosterone fluctuate predictably, following a daily rhythm. Testing at the wrong time can produce misleading results. For example, cortisol peaks in the morning and drops significantly by late afternoon. If tested in the evening, it may wrongly suggest adrenal fatigue. Lipid and glucose levels are also time-sensitive. Triglycerides tend to peak later in the day, while fasting glucose is most stable in the early morning. If seniors choose random times, results can be skewed, leading to misdiagnosis or unnecessary treatment. The best practice is to schedule tests early in the morning, ideally between 2 and 9 a.m., and to follow your doctor's specific timing instructions. Disclosing over-the-counter and herbal products. Number 2 is not informing your healthcare provider about all over-the-counter medications and herbal supplements. Many seniors believe these are harmless, but they can significantly alter blood chemistry. For example, NSAIDs like ibuprofen and aspirin can affect kidney function and liver enzymes, raising creatinine or lowering platelets. Herbal products like ginseng, turmeric, or garlic can interfere with hormone levels, blood pressure, and clotting tests. Some natural teas or supplements can even cause false readings for liver or kidney function. Always inform your doctor and lab technicians about any substances taken within 72 hours of testing. Bringing bottles or lists of all supplements ensures accurate interpretation. Reference ranges. The biggest misconception. Number 1 is assuming all labs use the same reference ranges. Many seniors and even some healthcare providers overlook that different labs can have varying standards, methodologies, and reference intervals. For example, one lab might define a normal TSH as 0.5 to 4.5, while another uses 0.4 to 4.0. This can lead to conflicting diagnoses, being labeled hypothyroid at one lab but normal at another. Research shows that up to 23% of patients with tests at multiple labs receive conflicting diagnoses solely because of differing reference ranges. The same applies to hemoglobin A1C, cholesterol, and other markers. Always note which lab performed your tests and ask your doctor to interpret trends over time rather than relying on absolute numbers alone. Consistency in testing location minimizes errors and ensures accurate monitoring of your health. Final thoughts: protect your health. Understanding these common mistakes can dramatically improve your health outcomes, from staying properly hydrated, disclosing all medications, scheduling tests at the right time, to avoiding certain foods and drinks. Small actions lead to big improvements. Many seniors unknowingly compromise their results and risk unnecessary treatments or misdiagnoses because they aren't aware of these pitfalls. Take charge of your health by communicating openly with your healthcare team, following fasting instructions precisely, and being mindful of recent illnesses or supplements. Remember, accurate blood tests are the foundation of proper diagnosis and effective treatment. By avoiding these 10 mistakes, you empower yourself to make informed decisions, reduce unnecessary interventions, and ultimately enjoy a healthier, more vibrant life.